When we're talking about human rights approaches, you need to understand what is a human rights approach. Human rights approaches to mental health rights in particular look at the role of the person as a right holder and with the ability to exercise that right. So there are two aspects. There's being a right holder and there's the aspect of exercising that right. And in everything we do, not just in health rights or in times of war, we all exercise our human rights. From the minute you wake up, you have the power to make a decision as to whether you will go to work or you won't go to work. That is holding a right. The fact that you can have a job, but you can also decide not to go to work. That is exercising your right. So if you lose a job, it was by your choice and not for other reasons. However, in mental health, you get to realize that a lot of these rights are restricted. And that's where now the denial of human rights approaches comes in. In mental health, people tend to look at rights from a needs-based approach. For instance, I am a person with a disability who probably uses a wheelchair. The needs-based approach will be provide me with a wheelchair. The human rights approach will be, the problem is not the wheelchair, the problem is the barriers that I face on a daily, including stairs. So if you provide me with a ramp, I'm able to live a more independent life than you providing me with a wheelchair, and I'll still have to crawl up the stairs. So that's a very basic understanding of human rights approaches to mental health from a disability angle. Now, in mental health, it's slightly complicated because disabilities are invisible in mental health. You'll find a lot of times persons with psychosocial disabilities, you cannot see schizophrenia, you cannot see bipolar, you cannot see anyone on the spectrum. Maybe a few other disabilities can be seen. For instance, Down syndrome has the facial effect. But when you're dealing with people who have mental disabilities, a loose term to refer to both psychosocial and intellectual disabilities, in most cases, their accommodations are different from the physical disabilities. And this is based on how they process information, if they have intellectual disabilities, or how the society responds to them where they have psychosocial disabilities. I'll give you an example. People with schizophrenia are deemed to be violent, which is actually false. People with schizophrenia do have their moments when they do have maybe hallucinations or hearing voices. And the violence actually comes from the frustrations of trying to explain themselves. It's more the society attacking them based on their wrong perceptions rather than the person attacking society. So here the barrier is the society and not the person. Persons with intellectual disabilities are the same. If you give me information that I don't understand, I am a lawyer. If you give me medical journals, of course I will not understand it. It will be noise to me. And however, if you give me legal books, I will be able to understand the legal information because I have been trained to understand that information. The same way with intellectual disabilities. One of the accommodations the persons with intellectual disabilities need is information in simple language, a language that they understand. When you start using big, complex words, that is where the frustration comes in and you end up losing the person. So human rights approaches is basically that, looking at the barriers and removing them in order to ensure that this person can live a better quality of life or access services that they need to live independently. So in human rights approaches, there's the rights, there's the ability to claim those rights, there's the access to support when I need to claim my rights, and there's the access to participate in claiming my rights. And a lot of times you find with a needs-based approach, these four elements are removed and it's based on mental capacity. What society thinks me as a person with psychosocial or intellectual disability can handle rather than what I myself define as what I can handle. And that is where the Convention of the Rights of Persons with Disabilities comes in to set up the standards. The standards that we're looking at here are Article 11 of the Convention of the Rights of Persons with Disabilities, Sustainable Development Goals number 3. We have the Geneva Conventions and the African Charter on Human and People's Rights, including the Protocol on Persons with Disabilities. Now, when you look at the Convention of the Rights of Persons with Disability, it actually, Article 12 recognizes that as a person with disability, I have the right to make my own decisions and participate in making my own decisions. Now, how that comes in terms of emergencies is Article 11, which talks about the situation of persons with disabilities who are in situations of risk and humanitarian emergencies. I am cognizant at this point of other laws, including public health acts and constitutions that define what emergencies look like and what measures should be taken. However, this does not remove the human rights from the context just because there's an emergency. Human rights always apply in all emergency situations and normal situations. So that is why Article 11 is crucial, because it specifically outlines how to deal with the rights of persons with disabilities in situations of risk and humanitarian emergencies, including what we're facing right now, which is basically a health emergency. And it talks about that all governments must adhere to the human rights standards set by the Convention of the Rights of Persons with Disabilities, the Geneva Conventions, and any other humanitarian law. So that is why we have highlighted the Geneva Conventions here. If you know anything about the Geneva Conventions, is just remember it applies during times of war a lot, and there are 4 conventions. So all the rules of war still apply even in health emergencies. Because what we're seeing right now globally as this virus ravages through the world is that we're seeing governments taking approaches such as mandating the military to provide health services, mandating factories to provide, to manufacture and provide equipment, mandating businesses to do to provide emergency and safety measures, which is not wrong. It is their right. However, you cannot take away people's rights just by on the basis of an emergency. The Geneva Conventions claim that even when you mandate the military, you still have to ensure human rights are adhered to. When you look at persons with disabilities at the moment, all the measures being taken by different governments, including lockdown, shutdowns, awareness creation, and dissemination of information, none of it is being made disability friendly. Yet, persons with disability are the most vulnerable. For instance, in this situation of being told not to touch surfaces, think about a blind person. How do they move without touching surfaces? And how have we ensured that we provide safety for them? Think about someone on a wheelchair. You're talking about lockdown and curfews, and they have to be a certain place by a certain time. Yet, there's no adequate, reasonable, accommodated public transport systems in most African countries, including ours, Kenya. When you go to the villages, even finding that wheelchair is impossible. So how am I, as a person with disability, supposed to comply with the government recommendations and such like issues? So those are some of the things that we're talking about, human rights standards and approaches that you have to think about. We're also looking at the Sustainable Development Goal number 3, which talks about achieving at the highest standard, attainable standard of health, and including mental well-being. So the SDG number 3 makes it a lot wider than just public health. It means that even in emergencies, you have to include mental health, and not just for persons with disabilities, but also for the general public. This situation of emergencies creates a lot of anxiety, panic, social disorder, and loss of jobs, financial constraints. How are we ensuring that even in this emergency, the health of the public, the general public, is also being maintained? And some of the measures you're seeing public health taking, I am not downgrading the role of public health, but a lot of the measures are a little bit draconian that can actually lead to death of people. In Kenya, we had a situation of a lady who was held in isolation and she ended up committing suicide. While it was for the public interest good, they forgot to include the mental health aspect, and therefore she still ended up dying. This is someone who could have lived. So one lesson we're learning from SDG number 3 is that even when you provide health, mental health has to go along with it. So while we are calling in doctors and emergency workers and nurses to come in, we also have to start looking at other health care workers who provide the support. We should be looking at psychologists, counselors, and psychiatric nurses as well. How can they provide matching services to the public health workers? And you're forgetting, it's not just about the general public. These workers are in the front line. They do need mental health services. So while we are discussing policies on the emergency, how are we ensuring that this policy also covers the frontline health workers? Then we have the African Charter and Protocol on Persons with Disabilities. And this should be read very strongly with the Geneva Conventions, because the African Charter has a very strong stance on situations of war. Well, right now the focus is on the pandemic. In Africa, we are in constant states of war. So the Charter captures persons, refugees and internally displaced persons who also come with their own mental health challenges based on whatever background they came from. They could have been victims of serious humanitarian crimes. They could have been forced to be child soldiers. And those are other things that you have to consider as you're providing whatever relevant immigration or asylum services you are providing to this group of people. And some of them even come with disabilities. They might have been injured in the war. So your service should not only be disability compliant, but it also requires it to be mental health compliant. So the Charter speaks into that space of war and humanitarian emergencies. How can we ensure that the mental health of refugees, internally displaced persons, is catered for, as we also provide for the human rights services? So some of the quick tips we're actually seeing coming out right now, we'll cover in the next session in greater detail. But the one thing that should remain clear is that human rights approaches still apply even in emergencies, and we have to especially consider persons with disabilities